My name is Colleen Rogers. I'm a ULO nursing student. I'm going to be assessing your respiratory status, your lungs and thorax today, okay?
Okay.
I'm going to ask you to just sit up like you are with your arms to your side and breathe normally. We already reviewed your history, and you have a history of asthma. You're not a non-smoker, and you take medications for your asthma. You're not having any chest pain or shortness of breath?
No.
Okay. So as I'm observing you, I'm looking to make sure that your respirations are even and unlabored. Your lips are pink, and your skin tone looks normal. Your skin is warm and dry. Your fingertips are nice and pink with no cyanosis or indication of hypoxia. Your sternum is midline, and there's no muscle retractions using accessory muscles such as your rectus abdominis or your shoulder muscles, and there's no flaring of your intercostal spaces or bulging of your intercostal spaces, and you have no flaring of your nostrils or pursed lip breathing, and no tripod positioning, which is all indications of having respiratory distress. Okay, I'm going to start by assessing your posterior thorax. If you could turn and face the wall for me, please. Okay, normally I would assess up against bare skin, but for purpose of this video, we're going to assess with your clothes on and assume that your skin would normally be a bare skin. And I would also have gloves on as I visualize your thorax and assess for any lesions, any visible lesions. And right now I'm assessing that your spinous process is midline and normal. There's no evidence of kyphosis, and you're not using your accessory muscles, your trapezius muscles or your shoulder muscles to help you breathe. So I'm going to begin by using my fingertips to palpate in your on your posterior lung fields, and I am palpating for masses, any visible lesions, and as just also crepitus, which is escaped air into your tissues. So I'll be moving my fingertips across your back. I'm also checking for tenderness. Let me know if you feel any tenderness as I move my fingertips across your back. Okay, I didn't feel any masses or any lesions, and did you have any tenderness as I was pressing? Okay, now I am going to assess for freminence. Freminence, which is the vibration that I'm going to feel as you say 99. I'm going to use the ball of my hand to assess for that.
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay, I didn't feel any crepitus or masses with that as well, and your normal fremitous vibration with 99. Now I am going to assess your expansion of your lungs and assess that your lungs are at a 45 degree angle, and I'm going to start with my thumbs at T9 to 10, and I'm going to ask you to take a deep breath in and out, please. Okay, and that assessed for your diaphragmatic expansion, which was symmetrical, as my thumbs move symmetrical in front across your back. So now I'm going to percuss your back, and for percussion I am testing for tone and resonance, and I should hear some dull flat sound over the scapula, and so now I'm going to be tapping on your back. Okay, and I didn't hear any dull sounds that would any flat sounds that would sound as if you had a tumor or abnormal density in your lung. So now I'm going to check for diaphragmatic excursion, which I'm going to use a ruler and a pen and make a mark on your back. And I'm going to start at T7 and percuss down. And as I'm percussing down, I'm going to ask you to take a deep breath and hold it. and then I'll let you know when you can breathe out again. Okay, so here we go, just below the scapula, and okay, when the sound changed to flat, I'm going to mark that spot right there with my ruler. And I have my pen to mark the spot. Then I'm going to press down. And mark that there. I'm going to do the same on the opposite side. You can breathe out. Okay, so I'm going to measure, and that's 3 centimeters. It's also 3 centimeters, it's symmetrical, and 3 centimeters is normal. Okay, now I'm going to listen to your breath sounds. And as I listen, I'm just going to ask you to breathe in and out through your mouth. Deep breath. In. Okay, I didn't hear any adventitious breath sounds such as crackles or wheezes. And if I heard some sonorous wheezes, I would have had you cough to clear your lung fields and listen again, but that wasn't present. So now I'm going to check for your bronchophy. And I'm going to ask you to say 99 again as I place my stethoscope. Each time I place my stethoscope, say 99, please. 99, 99, 99, 99. 99, 99, 99, 99, 99, 99. Okay, very good. And I heard a muffled sound of 99, which is normal sound that I should hear. Now I'm going to check for egoprophy, and I'm going to ask you to say the letter E as I listen. Say E, 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 E. Very good. And I heard the letter that I did not hear the sound of A. I heard E. A would indicate a tumor or density in the lung. And now I'm going to check for whispered petriculity. Now I'm going to ask you to say 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Very good. The sound was muffled, and that's a normal sound that I should hear. I'm going to ask you to turn around and face me again. Okay, now I'm going to ask you to relax again with your arms by your side, and we already did your visual assessment of your anterior thorax, and notice that you didn't have any lesions, you have no retractions of your accessory muscles, and no bulging of your intercostal spaces, and your sternum is midline, and your costal angle is at about 90 degrees, which is what it should be. And it's important to note that the anterior thorax is the only place you can hear the right middle lobe, because of the placement of the liver. The right middle lobe is not auscultatable through the posterior thorax. Okay, so I'm going to do the same thing with the fingers, and I'm going to be palpating again for any masses or crepitus and tenderness. Please let me know if you have any tenderness. Okay, any tenderness there? No. Okay, now I'm going to use the ball of my hands, and we're checking for fremitus and crackles as well. So as I assess, I want you to say 99.
99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and I didn't feel any crackles, and I'm sorry, any crepitus, and you had normal fremitus. Now I'm going to do percussion, the same way we did on your back, where I'm going to tap on your back, and I'm checking for the tone and resonance. Okay, I'm going to check for your normal expansion right below the sternum here, and I'm going to ask you to breathe in and out for me. Very good. You have normal expansion of your lungs, and it's symmetrical. Okay, now I'm going to check for the bronchophy, egophony, and whispered pectoriloquy. So I'm going to listen again and ask you to say 99.
99, 99, 99, 99, 99, 99.
Very good. Normal sounds, sounding dull and muffled. Now I'm going to ask you to say the letter E. E, 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 E. Okay, very good. And I could discern the letter E, and I did not hear the letter A, which would have been an abnormal sound. Okay. Now I'm going to ask you to do to say 1, 2, 3, and this will assess for whispered pectoriloquy.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, and the sound was normal and muffled, indiscernible. Now I'm going to just listen for your breath sounds, for your bronchial, bronchiovesicular, and vesicular breath sounds, and listen for any abnormals like crackles, rubs, or wheezes. Deep breath in through your mouth and out through your mouth, please. Very good. No adventitious breath sounds. And that will conclude our assessment today. Again, I'm Colleen Rogers, ULL nursing student, and I thank you for your time and your cooperation.
Thank you.